Annalise, there are questions now about how far this has spread within the White House.
That's a key concern after the president was diagnosed, and there are concerns about exactly how sick he is, because he is in a high-risk category at the age of 74, and also, we don't mean to be unkind to bring up, but he is classified as obese, which we know are pretty unforgiving categorisations, but that is a key comorbidity for people who do have coronavirus, and some are suggesting that's why he has been taken so promptly into medical care. His physician today, though, said that it's just because he is the president of the United States that they've gone to such extreme measures so early on. And giving an update, his personal medical team was certainly maintaining an upbeat, you could say, mood.
We are monitoring him very closely for any evidence of complications from either the coronavirus illness or the therapies that we are prescribing to make him better. We have monitored his cardiac function, his kidney function, his liver function. All of those are normal. And the president this morning is not on oxygen, not having difficulty breathing or walking around the White House medical unit upstairs. He's in exceptionally good spirits, and in fact, as we were completing our multidisciplinary rounds this morning, the quote he left us with was, "I feel like I could walk out of here today," and that was a very encouraging comment from the president.
Now, if you noticed that comment, though, about the president not on oxygen today, that raised concerns among the press corps that was there asking those questions about whether he'd been on oxygen on other days. And there was a repeated back and forth questioning, trying to clarify if he's been on oxygen at all. This is what his physicians had to say.
Has he ever been on supplemental oxygen?
Right now, he is not on oxygen.
I know you keep saying
That's
right now, but should we read into the fact that he had been previously?
Yesterday and today, he was not on oxygen.
So he has not been on it during his COVID treatment?
He's not on oxygen right now.
Now, one of the other confusions in this briefing was the description of the president's treatment in the last 48 hours and 72-hour periods. Now, that seemed to suggest to some that he'd actually been confirmed as having contracted coronavirus much earlier than they confirmed. And so there has been a further statement put out since then by his team saying the president was first diagnosed with COVID-19 on the evening of Thursday, October 1st, and had received Regeneron's antibody cocktail on Friday, October 2nd. Now, that is a fairly experimental drug cocktail you heard there, but what we heard from his team is they say that they think it's the best approach, especially early on in the illness, to try and get ahead before that inflammation kicks in and can bring those serious conditions later on. And so the question now is when the president might be expected to leave hospital, and his team wasn't giving any further clarification on that point either.
I don't want to put a hard date on that. He's doing so well, but with a known course of the illness, days 7 to 10, we get really concerned about the inflammatory phase 2. Given that we provided some of these advanced therapies so early in the course, a little bit earlier than most of the patients we know and follow, it's hard to tell where he is on that course. And so every day we're evaluating, does he need to be here? What does he need? And where's he going?
And Tim, as you mentioned before, the concerns are now spreading to where else this virus is spread within the White House. Hope Hicks, his key advisor, was the first to be confirmed as having COVID-19. It's still not clear whether she contracted it from the president or the other way around. Also, Kellyanne Conway, his key advisor who left just a few months ago but has been working with the president in the meantime, has contracted it as well. Mike Lee and Tom Tillis, both senators from Utah and North Carolina respectively. Bill Stepien has contracted COVID-19, the Trump campaign manager, Ronna McDaniel, RNC chairwoman, as well as John I. Jenkins. He's the University of Notre Dame president, and Chris Christie, who was helping with debate preparation for the president. But now, to those who've tested clear, Mike Pence and Karen Pence, the vice president, and his wife have both been cleared of having coronavirus. Ivanka Trump, as well as Jared Kushner and Eric Trump Jr. have all been cleared. Amy Coney Barrett, the Supreme Court nominee, spent quite a bit of time with the president recently during her nomination, but she's been cleared of having it. She did previously have it in March, and so it doesn't seem like she's recontracted it. Joe Biden and Jill Biden haven't contracted it either after being in close contact at the debate, or Mark Meadows, the White House Chief of Staff. But of course, with a 2-week incubation period, there are concerns that there could still be cases to come, including a significant cluster at the White House. And that's going to start putting pressure on the White House about exactly how they manage this coronavirus pandemic and keep the functions of government going. There are contingency plans if a president becomes incapacitated. There have been 8 US presidents who've died in office already, and so those procedures are quite clear. But under the 25th Amendment, the power would be transferred to the Vice President, and he could resume those powers. It's been used 3 times since it was implemented. Each time, though, has been for colonoscopies for Ronald Reagan and then for another president whose name escapes me. But they've both been fairly recently, and so it would be unprecedented, one for the history books, certainly, but just so close to the election is what's really putting pressure on so many in the US, wondering what's going to happen next.
That's the thing, isn't it, Annalise? We are 30 days away from the US election. We've just seen the debate 3 days ago, and Joe Biden, of course, was in Michigan yesterday. We see that Kamala Harris and Mike Pence, the Vice President's debate, will still go ahead.
They will indeed, and that's going to happen in Utah, but it seems like a lot of this is going to start moving virtual, and that's going to be a key point of difference. What's interesting to see is we haven't seen any swipes from Joe Biden yet at Donald Trump about his handling of the pandemic, the fact he's contracted coronavirus, being out and about. And in large gatherings, which he had previously condemned, he's very much taken a step back and said that he's praying for the President and the First Lady to recover, that they wish them well. And it's going to be the key issue is how sick he gets. If he recovers in the next 2 weeks and ends up having a mild case, it could end up firing up his supporters. It would go to his previous arguments that for most people it's not that bad, and so maybe they shouldn't have had the same level of shutdowns as they've had. But if it ends up being much worse, it could absolutely throw the US government into chaos, and that's going to be a big test for Joe Biden and how he responds.